Well, I'm Joyce Thomas. I'm the manager of Emergency Preparedness at Huntsville Hospital. I have been here about 33 years. I started my career out as a nurse in Huntsville in the ER. So we're at John Hunt Park here in Huntsville, and we've set up this, partnered with the City of Huntsville and Thrive, Alabama, and Huntsville Hospital to do a big community testing location. We thought if we could pull it in one location, kind of center Huntsville, it'd make it more convenient for those that have been exposed to someone with COVID-19 to come in for testing. Of course, we treat all patients, even in the hospital, average patient, as if they have something that could be contagious. So we really just try to wear our PPE and assume that everyone is positive. That's the way we treat them, is everyone is positive until proven otherwise. So we do the highest level of PPE that we can wear out here, which we would do at the hospital. They do universal precautions there as well. Oh gosh, every day I can come in and find something positive from this. The teamwork that we have in there is awesome. They pitch in, they do, and it's not a job to them. They want to help. They want to be a part of the hospital's mission, and they want to do what they can. They want to be a part of this team. And I tell them that every day. You are making a difference. You are part of the front line. We are helping. You know, we've probably seen over 8,000 people come through our mobile site, and they're helping. The teamwork is awesome, but every day the looks in some of these patients' eyes that you see, they're very appreciative of what we do. Prior to COVID-19, you know, I did disaster planning, we did the drills, we planned for a pandemic, we planned for mass casualty, and we have a good plan, but this is a very large event. I don't think we quite had a grip on what we're seeing now. But we're living the disaster now. We've been in it since March, we're living it. We're writing plans for the future as we go.
I'm Stacy Langford. I'm an RN, and I've been with Huntsville Hospital for 19 years, and all of it in the emergency department. When I first arrive at work, get report from the night shift supervisor, any challenges that they ran into. Big focus is to look and see, have we expanded our COVID pod, or are we still contained into 13 beds? We have, our department is broken up into pods, and the best way to think of that is like mini emergency departments all in one. So each pod has its own physician, its own set of nurses, its own technicians that are there. But there's 13 beds there, and so that's where we primarily try to contain patients that need to be tested or who come into us and they say, I'm positive and I'm having difficulty breathing. A lot of times here recently we've exceeded those 13 beds. So that's my first, after I get an update from them, any challenges, is to see, how do we look right now? We see patients that are coming in, it's body aches, chills, I'm feeling short of breath, I've had a cough. Or patients that say, hey, I was at a friend's get together and they called me yesterday and they told me they tested positive and I'm scared and I want to be tested. Or patients who come and, I've been positive for a week, I've already been diagnosed and I was feeling fine, but now I'm starting to have difficulty breathing. So it's more respiratory complaints. It sounds similar to the flu cases, which we're used to seeing in flu season in the summer. It's like, okay, this is different. That's the majority that's in the pod. We do get unstable patients that are brought in by ambulance that are unresponsive, or they are really struggling so much to breathe that we have to put them on the ventilator. It's different because even though we're running COVID patients and suspected COVID-19 patients, we still have not stopped traumas. So we're still a level 1 trauma center, so we still have the regular car accidents, motorcycle accidents. Before, we knew if all of our pods were full, unfortunately we have to treat patients in a hall bed. And if our lobby had 10, 20 patients, it's not ideal, but it was pretty much routine for us. Now it's more of a focus, okay, we have 7 people in the lobby, this is a problem, this is too many because we don't want increased exposure. How do we expedite getting them back to a regular room? In addition, we still have our patients that need to be treated or tested for COVID that are arriving. They come through a separate entrance. And so really watching that, like how many are waiting in the garage that need to come in, that is a different workflow mindset of watching our capacity and and then trying to balance the two. Our family knows I'm just going to be there. They pretty much want me not around. It's like, don't come around us because you are in a high-risk area. We don't want it. Just, text us and we can FaceTime. But we're good being a distance. So they understand the hours. They, of course, want to, know updates. So are you all seeing more? And are people getting sick? And, well, I thought the numbers were going down. And because you see so much on the news, so you're really not sure.
My name is Dawn Webster. I am the director of the Respiratory Care unit, and I have been with the hospital in total for about 24 years. Well, with the Respiratory Care unit, our focus is pulmonary patients, so we see a lot of people with COPD, chronic obstructive pulmonary disease. We see pneumonias, mainly things that have some type of respiratory origin. And since March, we have been taking care of COVID patients as well. Well, COVID patients require a lot more resources, and that can be staffing, PPE. It takes a lot more to care for these patient types. The nurses that take care of these patients have a lower nurse to patient ratio, so they can provide the additional help that these patients need. And it can be taxing at times on staffing if we don't have enough staff there to begin with, because we are requiring extra nurses. When we first started getting these patients, it was on a weekend, and I remember it was a Saturday, and I remember the first huddle that we had with our nurses after we got that patient, going in the room. I could tell that a lot of them were really uneasy about this, because we had been hearing about this, and now it was here. Now we had one of those patients on the unit. And, I did see some fear and uncertainty, but, once we started talking to the staff, after a moment of silence, the first nurse stepped up, then we had a second nurse step up, and then we had another one step up. And they've continued to step up every day since then. Initially we got one of the first COVID patients in the hospital in mid-March, and a lot of taking care of those patients we were learning as we went along, and working with other members of the healthcare team, infection control, and others as far as developing the process for taking care of these patients. And some of it was trial and error. We would have a method on how to do something, and then staff would discover after several days, hey, there's an easier way to do this. Where we've been doing it now for 4 months, so it's just kind of become our new workflow. As far as the hours of the job, honestly, it's 24/7, even when I'm not physically at the hospital. It's very difficult to detach from the job because I have patients and staff there 24/7. So there's always someone calling me with a need, or I'm participating with a virtual meeting, or I'm getting texts from staff about something. Real life right now is really hard. It's very hard to have a work-life balance. I have twins, they're 9 years old, so they are still young enough that they need a lot from me. And luckily, my husband has stepped in and taken over a lot of the things that I used to do for them. But it's really hard when I am at home with my family to be with my family mentally and not be thinking about what is going on at work, and trying to put my focus on my family, because this has been very stressful on them too. Well, I think it's harder for staff because we get to know these patients on a more personal level, because we have to be there to support them. They don't have the family at the bedside. So we're learning about their sons, we're learning about their occupation. We've had several patients that they tell us, they're fearful. They don't know what is going to happen to them. Maybe they've never been in the hospital before. So we do our best to try to be there to support these patients. And, they are there for a long period of time. Typically, our COVID positive patients have longer hospital stays. So staff get to know them more and learn personal things about them. And it can be harder when on staff when that patient does decline, and then, maybe we're thinking about what kind of impact this is going to have on this patient's sons now that he's not here anymore. Or we had a patient that was 96 years old, and we thought about that with her. That lady had lived for 96 years and had been through a lot and had done a lot, and you hate for her death to be the way that it was when she was alone, other than hospital staff at the bedside. Work is very hard, and it has been very hard for the last 4 months, harder than it's ever been for any of my employees. None of us have ever worked through a pandemic before. And, we all have families that we are leaving at home and coming in so we can take care of these patients. And it's very disheartening when we see a lot of negativity on social media or on news, or just hear things from our neighbors. I hate that this has become a political issue, because it's not political. This is a health issue. And when we are doing everything that we can for our 12-hour shift or our 8-hour shift to take care of these patients, it's frustrating for us when we hear complaints from a neighbor about a small inconvenience of wearing a mask for 20 minutes while they go in the grocery store. So what we need from our community is we need support. All the healthcare workers need support. We need people to treat this as a real disease, because it is, and it's affecting a lot of people, and we see our patients and our families struggle with this. And I think until someone has actually worked in this environment or been a patient themselves or had a family member with this, it's really hard for people to realize what all is going on. And sometimes people, I think, tend to focus more on how it affects them personally. And this for social distancing, avoiding large crowds, wearing masks, we need everybody to do that. So for that to be most effective, everybody has to do that. We have to look out for each other. It can't just be about any one person. When we first started with this, it was great. We felt a lot of love and support from the community. We had meals bought at times, gift cards, people, meeting in the parking lot and blowing horns, their car horns, that kind of thing. And I think as we have gotten more used to this, people overall are just kind of tired of hearing about this. And I think that staff, I feel like, are feeling less support from the outside now than they did before. And it's harder now than it ever has. I mean, we are seeing a lot more of these patients than we were 3 months ago. So I think just continue to show support, thank your healthcare worker, and do everything that you can to help protect yourself and your family and your neighbor.
Until we know more about this virus and we can get a vaccine or a cure or a definitive treatment, then if everyone could comply with wearing a mask and be socially distant is our biggest help.
I think that separate, sanitize, wear a mask, and also just take it very seriously. We don't know what's coming. We've got to keep this thing down, keep it controlled.